Well, as we celebrate and gather for Thanksgiving this year, some are still dealing with the lingering effects from the pandemic. A new book called The Long Haul looks at how long COVID is changing the future of healthcare and the economic implications if more isn't done.
Author Ryan Pryor talked to hundreds of long-haul patients who shared how the illness exacts a huge personal toll. He also told KITV4's Diana Coe how these patients' suffering will affect all of us.
And I just did a breathing treatment, but as you can see, my voice and my coughing is not better.
Honolulu resident Angela Keene got COVID in 2020 and July of 2022. She's never fully recovered.
You feel real junk and you can't sleep, or you sleep too much, you're fatigued, your muscles hurt, you can't think, you're foggy, you forget things, you're kind of out of it.
She couldn't work for a while.
I was actually being encouraged to go on disability, and I wasn't ready for that.
She is not alone. She is one of millions of people worldwide who have or will have long COVID. Okay. Journalist Ryan Pryor's new book, The Long Haul, solving the puzzle of the pandemic's long haulers and how they're changing healthcare forever, is about people like her and how long COVID patients themselves raise the alarm about the illness. And a broader look.
It's a book about the long-term effects of viruses and bacteria in general that post-infectious diseases have been around for a long time. And long COVID is forcing a reckoning with these types of diseases that were neglected for decades or centuries.
Keene agrees.
Of the 80s and the 90s, when we talked about fibromyalgia and chronic fatigue, and people thought it was bunk, and these people are still suffering. And now you've got a whole population of long COVID patients joining them.
Pryor says our state did better than most others in containing the virus.
Hawaii's experience with COVID was that there are significantly fewer cases, especially early on. Therefore, there's fewer long COVID cases than there are in other states because Hawaii was more vigilant.
Pryor also looks at the economic cost.
$3.7 trillion in economic damage in inability to work and the medical costs, specifically from long COVID.
All of this, he hopes, creates the impetus to improve healthcare.
We need to design a more patient-centered healthcare so that patient voices and patient advocacy movements need to be brought into the healthcare system.
All right, Ryan Pryor, author of The Long Haul. Thank you so much for talking to us. Diana Coe, KITV4 Island News.